I'm Marja-Riitta Taskinen, and I am Professor Emerita in the University of Helsinki, Finland. Non-alcoholic fatty liver disease is in fact that there's excess fat accumulating in the hepatocytes, and it can come either from fatty acid in the circulation or from de novo lipogenesis, or less also from the catabolism of triglyceride-rich particles which are circulating in our blood. And hepatocytes do not want to have too much fat, so they do want to get rid of that, because otherwise there would be so-called lipotoxic action. And why is non-alcoholic fatty liver disease increasing so rapidly is that it is linked to obesity, and it's common in type 2 diabetics, and we have epidemics of both obesity and type 2 diabetes in the world. We should recognize that there are two different types of components of non-alcoholic fatty liver disease. One which is metabolic, and the second one where the genes are playing an important role. And there are three genotypes which are reasonably common in the population level. So they can cause the accumulation of fat in the hepatocytes. On the other hand, the most common, of course, is the metabolic alcoholic fatty liver disease, which linked to the insulin resistance and which is common in diabetes and which definitely linked to the obesity. But these two different, so to say, subtypes can also coexist, because that is also a very big group between the two. Excess liver fat, first of all, it is common in type 2 diabetic patients, more common than in non-diabetic or lean people. So it's also linked to the obesity. And in addition to that, there are other factors which are increasing the fat in hepatocytes. There is a link between de novo lipogenesis, which means really synthesis of fat in the liver, and type 2 diabetes, because de novo lipogenesis is coupled to hyperglycemia, and hyperglycemia is increasing that, and of course that is typical in type 2 diabetes. Considering prevention of fatty liver, the key question, of course, is the lifestyle. That is the primary, so to say, way how we can influence the fat accumulation in the liver. There has been a lot of debate, so what's more important? Is it really the production of the fat, or is it the catabolic rate of the fat? And the current opinion is that this catabolic rate of the fat is more important to protect liver cells against the toxic effect of fat accumulation than in fact the production. And in this catabolic process, that is called lipolysis. So ApoC3 has turned out to be one very important regulator of this lipolytic enzyme, lipoprotein lipase over there. And also ApoC3 is influenced again by hyperglycemia, so that is one way in type 2 diabetics how we can lower ApoC3 is to prevent the elevation of blood glucose. We have, even today, several compounds which can really reduce liver fat, and of course one group which is very important is GLP-1 agonist. That is incretin hormone secreted in response to food intake, GLP-1. And GLP-1 agonist will reduce the liver fat. On the other hand, there's another group of drugs which has been used in the treatment of type 2 diabetes. glutazones, and they are also known to reduce liver fat. And there are several compounds in the development phase which will reduce liver fat. I think the key issue over here is that liver fat is so common that today there's indication for drug treatment only when you already have the inflammation in addition to the fat accumulation. That means steatosis.